My name is Alvin, by the way. I'm an RN. I'm a public health nurse. I'm also a wound care nurse, basic nursing procedure. So what we want to do, we want to be able to apply what we do in the hospital in the caregiving or the home care as well, and in long-term or short-term care. And every aspect of our training is very important that we, prevent, we monitor infection control. So infection control, patient safety, and comfort is one of our primary objectives and make sure we maintain that. So number one, nurses, caregivers, hand hygiene is very important from the beginning of your patient care. And then when you're done, we want to avoid spreading any kind of germs. And we are the forefront of patient care. So hand hygiene, guys, 20 seconds at least, scrub every single finger you can because it's very, very important. And then we want to be able to ensure privacy for the patient, make sure you understand the patient's concerns, and make sure the patient is safe and ready to perform this type of perineal care for this time. And then make sure all of your supplies are also at bedside, ready, and primary before putting on new diapers after removing the soiled diapers or soiled UniSUC. Make sure you always do perineal care. Perineal care is one of the most important in preventing skin macerations, the skin breakdown, and prevention of UTIs. So let's talk about the UniSUC-Whisper System. This is the Whisper pump. This Whisper pump is just like it runs just like any other devices out there, and it also siphons and suctions any kind of fluid on the patient. So what makes our pump a little bit different? It's ultra quiet. It can run 24/7, and it's convenient with all the accessories that come with it. So when you receive your parts, your UniSUC Whisper pump system, it's going to come along with the power and accessories. This comes with a disposable liner holder. It comes with a frame holder. What we normally use with this flame holder, we want to be able to disinfect and rinse and make sure we allow it to hang and then let it dry. In some cases, I always like to prep my system and apply a pre-assembled UniSUC. It also comes with a holder for the canister, as you can see. And then we also have an optional accessory, which is a portable battery pack, which they can receive from our website. So that's really the aspect of this. It also comes with a tube, either 6 foot or 10 foot. Now, the canister is one of the most important aspects of this. We want to make sure that the canister, when you assemble this, it comes with a tube. It's like a 9-inch, 10-inch long tube that directly mounts to the canister. And it's always important that these canisters are sealed. They'll come in loose or so. And what you want to do is make sure you just clamp it, seal it all around, and make sure the cap is fully covered. And then place in on the center, that's where it connects to the pump. So I'm going to turn this on. And as you can hear, it's virtually quiet. And what we always want to do is we always want to make sure we test for leakages, assuring that the cap is closed on all areas of the canister. And then always put your finger here and listen for a hiss. That's very, very important because when you hear that, you know that you don't have any leakages. So the next step is the UniSUC frame itself, the UniSUC system. As you can see, this UniSUC system comes in two parts. One is its flexible frame, which is molds to the body, contours to the body, and it has a cup on the very bottom. This cup has multiple functions. The first function is really the cup should be capturing the urine as it's placed in. So this cup allows the urine to come in from the inside and it's siphoned out through these tubes. This frame molds to the body, and that's very important how this functions, the frame, because now it could be shaped to any body frame, which means that the patient could be obese or the patient could be petite. So no matter what the patient size is, it can it's up to you on how to make sure you apply it to the patient. And we're going to go over all this later on in a few minutes of this. So you also have the secondary items called the liner. The liner is a disposable liner, which means that if it gets soiled, you dispose it. We have the frame, which is reusable, and make sure that, I know it's bad practice that a lot of people who's used the PureWorks system, they basically just throw away the whole thing. We don't do that anymore. We're environmentally conscious. We don't want to throw any more waste in the landfill. And so what we want to do is we want to be able to just reuse this frame repeatedly. And this frame comes with 2 ports, either left or right. And so make sure that this is the new frame. The older frame only has 1 port, but we're transitioning over with the newer frames slowly until we deplete all of our older inventory. But as you can see, if you want to place the hose either on the left side or on the right side, it depends on each. All you have to do is just remove the cap and then place it on the other end. So in this case, what I want to do is since I have the pump on my right side or the patient's left side, we're going to make sure that the port is on the right side of the patient. So we just switch that over. And so you have that flexibility as far as using these ports. This pump should always be placed on the bottom of the bed. You can place it on the bedside on a cupboard, but it's always best to keep it on the bottom. There are several reasons why we like that. Is because number one, it prevents from people seeing the device on the top. Hygienic, we want to cover it for privacy. Also, once you plug this in, it allows an easier suction away from the patient. It has a stronger pull when we're trying to utilize gravity. So going back to the frame, we're going to go through some details on making sure how this works. Furthermore, there's another feature. This cup, by the way, if it's placed below above the anus, this is one of the design of it, is that it prevents feces from going up to the vagina, particularly for the female here. Because what this cup does, it's shaped so that when you place it on the inguinal crease of the patient, it prevents the feces from climbing up because it's blocked. And that's why we have this angled shape on the cup base. So that's the function and purpose for it. So in any case, this mannequin here, just want to let you know, it does urinate. Okay, so you can see. And so with this patient, I'm going to go ahead and put on a glove. Best practice before you start touching the patient, you do the perineal care, always wear gloves. So we're just going to perform this in the same way as we would normally perform on a patient. Okay. Of course, we want to just show it to you. This is perineal care for this patient. And then when we have, and we're going to assume that this frame is used. And so after it's been used, we just want to do is just pull out the entire unit. And we're going to go ahead and just kind of hold it in place like that. And use your glove and always hold from the plastic side of it and just pull it away so that you're not contaminating your hand as much. So essentially, you pull it out, you just throw it away, and you're going to go ahead and get a new liner. And so what we want to do is always make sure that you have this curvature and make sure that these tubes are straight. Just like I'm holding it. I always like to try to hold it with the end clasped just like this. And we want to keep that shape because this is the shape of the patient. And with a new liner, what we want to do is just simply put it through and then bring it all the way to the tip. Once it reaches the tip, that's your stopping point. And there are 2 holes on each end of the liner. Just look for that, you'll feel it, and the tube will pretty much find itself. And so once you have that assembled, just like this, always push it in the middle. As you can see, you have that little cup shape. And so this is what makes it very comfortable for our patients. That is, a female can use it or a male can use it. With a female, we're no longer going to shove it in the labia. We just kind of put it on the side and then push it in. For the male, if they have inverted penile, it doesn't matter. It's just a cup. It's very comfortable and it's suitable for any body shape. So with this particular patient, it's like a BMI is around 20s, but sometimes we have patients that are BMIs are 30 plus, or they're fairly obese. So this also has a very important function. Whenever we look at patients, the pannus and the abdominal area, when you open that skin fold, you're probably going to notice that there are some skin maceration there, dryness, chapped skin. What we would normally do, of course, we wipe it down, clean it, and apply zinc ointment to it. And then we would put like an intertrigo or perhaps like a band of cotton to prevent that from reoccurring. One of the functions that we have for this device is you literally can place that in the skin fold. And that's very, very helpful because it acts like the interdry, but with more features to it. Because when you plug this in, it creates this. It pulls the air from the environment and draws it within this area as well. So what you're doing is you're creating an airflow on the pannus, on the skin fold, or in the areas where the inguinal creases are, or the groin crease. And that's very, very important because when you place this, you have to make sure that you place it between the skin fold. And of course, people are concerned you might cause like pressure ulcers, but we've had zero incidences with that at this time. So placement is very, very important. How we apply this. Okay, this is where a lot of people have trouble because sometimes when they wake up, this is dislodged, and that's what causes the leaks. So what we want to do is this bottom area is very, very important. And in this cup, we want to make sure the bottom and the sides are pressed against the skin as comfortable as possible, but not to a point where it's hurting the patient. So that's why you have to make sure you monitor the patient's comfort. You look at if the patient is nonverbal, make sure you're just looking at signals from the patient. So as you can see, what I'm doing is I like to press my hand right in the inguinal area here on the bottom area and make sure that the frame is contoured against the skin. This is very, very important because now when you press it in, you ask the patient if the patient is comfortable, if it hurts or anything, make sure they're saying yes or no. And then if so, just respond to the patient and make sure that you adjust it to the patient's comfort. So as you can see in this case, it essentially just holds itself. And that's very important to see that if it holds it, the patient can be a bit more freer on the bed. But it's always very important to provide some kind of support. Sometimes in the hospital, they don't allow diapers, so they use disposable underwear, which we can do. And we can also use regular adult underwear on the patient, as well as, in this case, I have it set up using a diaper. And the reason for this is sometimes it's hard to control, but there are patients who can moves around and it'll dislodge the unit. So if you have a diaper over it, it secures it in place even more. And so giving this, now you have a dual protection. It keeps the UniSUC in place and in position. So what we're going to do, we're going to go ahead and give it a try here. So this is one of the troubleshooting that we're actually going to be reintroducing again later. Some cases, some patients continue to have this leakage and they can't seem to understand why it's doing it. And I always like, just like in the hospital, we're able to apply these maxi pads. And usually the thickest ones are always the best. And you can always do an extra support by placing it on the bottom of the patient, just like you see here, and just securely keeping it in place on the outside. And then you can double it with a diaper. That's that basically reassures that any leakages will be captured. And that's very, very important. So as you can see, I have it running here. And then what we want to do is we always want to continue testing the canister, make sure there is no leakages. What I like to do is I'm going to put my finger here. You hear that? That's very, very important. That we know that there's no leaks. Everything is secured. And then we just plug it in and secure this. And if you push it in hard enough, it will stick on its own. But sometimes some of our patients are very active at night. Sometimes they accidentally pull it. And I'm going to show you as well a trick on how to keep that in the patient. But for now, let's go ahead and proceed with this. Here, we're going to go ahead and let this patient urinate. As you can hear, there's going to be that slurping sound. And what I like to do is, like I said, if you place it properly in the groin crease or the inguinal of the skin, you should be okay. And that's very, very important because that's what actually creates the leak. So over here on this side, push it in nice and comfortable, but make sure it's in the skin fold. And that's what's going to create that proper mount. Okay. So in this case, I'm going to do, since it's a bit loose here, what I'm going to do is I'm going to hold it in. Like I said earlier, sometimes a patient has a tendency to wrap their arm and then pull on the line. What I would like to do, what I often suggest is just place a tube and hide it in the diaper. Like so. Hide it away so that the patient is not able to just grasp it and pull it away. And make sure this is nice and tight. And just like any other diaper, how you apply it. As you can see, the patient does have dignity. We're not playing around with the private area as much. And essentially, this patient can now be a bit more mobile. They can, if you have a physical therapist, you can do range of motion, and you can actually transfer the patient, just turn it off and transfer the patient to a chair, and they can continue using this. And so during the night, one of the aspects, whenever I say that the patient will be dry, usually take about 3 to 4 hours after the last urination. And the reason why the patient would often be dry is, let me explain to you how this system functions. As you can see, you can hear that gurgling sound. Now, we want to make sure that sometimes that gurgling sound doesn't go away. It gets trapped on this tube because, as you can see, this tube is high, low, then high again. So gravity will keep some of these liquid fluid on the bottom area. So if you place this on the ground, you're going to create this effect. You're going to create this effect of what I call the water slide effect. So you want to make sure that if you place it on the ground, you have the tube constantly on a down slope. Because if you do that, you're going to prevent some of the fluid from getting stuck on a under shape here. So that's one of the reasons why I said earlier that if you place it on the bottom of the bed, it actually makes it easier for the fluid to siphon through. So as you can hear, you heard that slurping sound a few minutes ago. Then once it's completely evacuated, all the fluid, now you're going to hear a hiss. When you hear that hissing sound is really directed so that the airflow goes in from the pannus, from the abdomen area, and then brings it down to the very bottom. And that continuous airflow is like blowing a fan in that area. Give it about 3 to 4 hours, you're literally going to feel this dry. Unless, of course, the patient urinates again in the last 2 hours. You may not see that. But the effect is quite real, that if you were to leave it alone, if the patient doesn't urinate like 3 to 4 hours, you will literally pull away the entire moisture in this area. So as far as the placement, I think we've already discussed that. As far as the securing it with a diaper, we've discussed that. Different possibilities of using other external device or pads that we currently use. It's better to integrate these, but the main purpose is really to reduce the uses of these diapers or these pads. But these do support and prevent any small minor leakages. Furthermore, I mean, it's just pretty easy to use, as you can see. We also now have a wheelchair version. You can just go on our online where you can see that this patient does not have to only be on a supine or lying position. The patient can also be on a sofa watching television or sitting on a wheelchair. We do have now the portable package system where you can carry this pump and hold it with you, take it with you in the car, bring your patient or your family member with you. And it literally just gives them a lot more freedom to be, especially, being in bedbound all day. This is something that would be, a new opportunity for them to explore. And it helps build our activity of daily living. And it's very important for all of our patients. And of course, people are going to have difficulty sometimes trying to start off with this, but usually you'll find a way to adjust and modify it for the patient's use. It's this, that to create that seal, it's always on the bottom area. Make sure that this base is comfortably fitted on the lower inguinal area, and the seal really is created down in this bottom area. Up here could be a little bit more loose, but down here is what's important. So every patient might be a bit different. Their body size are going to be different. Their BMI is going to be different. So you're going to have to learn and modify it to the patient's condition.